The October 1st, 2013 deployment of the HealthCare.gov digital platform remains one of the most visible, heavily scrutinized, and consequential software development failures in modern history. Tasked with serving as the central federal marketplace for the Affordable Care Act, or ACA, the platform was legally mandated to provide a mechanism through which millions of uninsured Americans could compare healthcare plans, determine their eligibility for federal subsidies, and execute complex enrollments across a fragmented ecosystem of private and public databases. Instead of delivering on this legislative promise, the rollout devolved into a catastrophic, full-scale system failure. Plagued by infinite loading screens, systemic software crashes, and an underlying architecture fundamentally incapable of processing the anticipated volume of concurrent user traffic, the initial launch resulted in virtually zero successful enrollments during its initial deployment phase, commanding an exorbitant financial toll that analysts estimate reached upwards of $400 million. The root causes of this catastrophe were not merely isolated coding anomalies or routine launch day traffic spikes. Rather, they were the inevitable manifestations of profound systemic project management and procurement failures. The initial build was strictly governed by a rigid top-down multi-year waterfall methodology executed within a massive and inflexible bureaucratic framework. The Centers for Medicare and Medicaid Services, or CMS, severely mismanaged its assumed role as the lead system integrator, overseeing a deeply fractured and siloed ecosystem of 55 disconnected federal contractors. Fatal executive decisions, such as mandating arbitrary political deadlines over glaring technical realities, relying on fundamentally flawed testing paradigms that favored paper compliance over functional viability, and initiating devastating late-stage scope changes guaranteed a compromised product deployment. The internal warnings were stark. The Chief Information Security Officer, or CISO, explicitly recommended denying the system's authority to operate due to severe security vulnerabilities, yet these warnings were systematically overruled by leadership committed to the political launch date. The eventual stabilization and operational recovery of the platform required a radical, unprecedented departure from traditional public sector procurement and management norms. The rapid turnaround was spearheaded by a small, highly specialized rescue team of private sector technology veterans, often referred to as the tech surge, who aggressively discarded the multi-year bureaucratic roadmaps and implemented Agile software development frameworks, specifically relying on the iterative Scrum methodologies. By centralizing technical operations into a single collaborative workspace, or war room, applying continuous delivery models, establishing missing end-to-end performance monitoring, and prioritizing the stabilization of the user-facing registration interface, this small rescue team successfully stabilized the system and salvaged the federal initiative. This video analysis posits that the HealthCare.gov project serves as the definitive contemporary case study contrasting the inherent dangers of traditional highly siloed waterfall development with the empirically proven effectiveness of iterative, adaptable, and highly coordinated Agile methodologies. The initial failure and subsequent rescue operation did more than merely save the ACA's digital infrastructure. It triggered a systemic paradigm shift in federal technology procurement. This pivot ultimately resulted in the institutional creation of the United States Digital Service, or USDS, the formalization of modern digital delivery frameworks such as the Delivery Services Playbook, and the establishment of the TechFAR Handbook, thereby fundamentally altering how public sector entities procure and deploy large-scale digital architecture. The legislative passage of the Affordable Care Act on March 23, 2010 represented a monumental domestic policy achievement, effectively legally mandating the United States Department of Health and Human Services, or HHS, to architect and launch a fully functional federal healthcare exchange by October 1, 2013. This legislative mandate carried immense demographic scale, unprecedented financial cost, and astronomically high political stakes. Designed to serve residents in the 36 states that opted against building their own localized state exchanges, the digital infrastructure of the ACA encapsulated the HealthCare.gov platform was tasked with an integration challenge of staggering complexity. The system was required to seamlessly synthesize and cross-verify real-time data across 50 independent state Medicaid systems, the Internal Revenue Service, the Department of Homeland Security, and the proprietary databases of numerous private insurance providers. The initial financial commitment to achieve this integration was immense, with initial contract awards to the primary development vendors, including CGI Federal, Optum/QSSI, and Verizon, totaling hundreds of millions of taxpayer dollars. Ultimately, the cumulative cost of the initial failed build ballooned to an estimated $400 million. When the system officially went live to the general public on the morning of October 1, 2013, the anticipated flood of millions of users hit a digital wall. The day one crash was spectacularly complete. Consumers attempting to access their newly legislated benefits were met with infinite loading screens, unintelligible error messages, and an absolute inability to progress past the mandatory initial account creation portal. The sophisticated real-time verification algorithms that were supposed to confirm citizenship and tax status buckled under the load, the underlying databases locked up, and the physical hardware outages orchestrated by the hosting contractors completely disrupted the cloud platform. Independent assessments conducted in the immediate aftermath of the launch identified an astonishing catalog of more than 600 distinct hardware and software defects. The highly public failure of the website threatened to rapidly unravel the signature domestic policy achievement of the sitting presidential administration, transforming a long-awaited public service into a stark, undeniable demonstration of technological incompetence on a national scale. God bless America. Amidst the cascading chaos of a massive government bureaucracy attempting to navigate and salvage a rapidly deteriorating political and technical situation, an unlikely and highly specialized group of engineers emerged to alter the trajectory of the project. A trauma team, recruited from the upper echelons of the private technology sector, was brought in to triage the massive system's failure. This effort, led by U.S. Chief Technology Officer Todd Park, recruited elite talent possessing critical skills in hyperscale systems management. Key figures included Mikey Dickerson, recruited from Google, who worked alongside a cadre of highly capable engineers and product managers. Abandoning standard lethargic bureaucratic protocols, this small specialized unit of technologists orchestrated a high-velocity emergency rescue operation that systematically decoupled the broken architecture, stabilized the transactional databases, and deployed critical code fixes at a pace that was entirely unprecedented within the federal government. The primary objective of this video is to deeply examine the systemic project management, organizational, and architectural failures that define the initial HealthCare.gov build, and to analyze the agile methodologies, technical pivots, and cultural shifts that ultimately saved the platform. By dissecting the organizational behaviors, vendor management strategies, database architecture decisions, and software development lifecycles employed during both the initial collapse and subsequent rescue, this video extracts critical and highly actionable lessons for modern enterprises and public sector agencies executing large-scale, highly complex technical integration initiatives. The catastrophic failure of HealthCare.gov upon its launch was not the result of a single localized technical glitch or an unpredictable anomaly in user traffic. Rather, it was the inevitable culmination of a deeply flawed organizational architecture attempting to execute a highly complex, synchronous systems integration using obsolete management frameworks. The anatomy of this disaster is characterized by a reliance on rigid administrative methodologies, extreme and uncoordinated organizational silos, and arbitrary and politically mandated deadlines, unorthodox technical architecture decisions, and an abject system failure in quality assurance protocols. In short, a typical Monday in software development. The fundamental architecture of the project management lifecycle was strictly structured around a rigid, top-down, multi-year plan universally recognized as the Waterfall methodology. In standard functional waterfall development, project phases encompassing requirements gathering, system design, code implementation, integration testing, and final deployment flow sequentially downwards, with each phase requiring complete sign-off before the next begins. However, recognizing that the legislative timeline was exponentially tight, CMS attempted to manage the impossibly compressed schedule by implementing a highly destructive parallel stacking of all project phases. creating a chaotic environment where subsequent implementation phases were aggressively initiated long before previous prerequisite architectural and design phases were finalized and validated. The preparation and development phase, spanning from March 2010 to December 2012, was almost entirely consumed by extensive legislative and policy development. This bureaucratic focus delayed HHS and CMS from establishing the concrete technical and operational requirements of the website for nearly 3 years. The actual technical build of the platform was compressed into a brief 9-month window stretching from January 2013 to September 2013, an absurdly short time frame for engineering a system requiring real-time integration across dozens of sovereign state and federal entities. Furthermore, policy and scope requirements continued to shift dynamically well into 2013. The deadline for states to declare whether they would establish their own local marketplaces or rely on the federal exchange was pushed to December 2012, leaving profound architectural decisions regarding system capacity and database routing entirely unresolved until the final months of the development. As the October 1, 2013 launch date neared and internal technical problems demonstrably worse, CMS staff and executive contractors fell victim to severe psychological and organizational path dependency. Rather than adapting to the emerging technical realities, acknowledging the impossibility of the schedule, or delaying the launch to ensure system integrity, they stubbornly continued to follow the established schedule. Officials became dangerously desensitized to persistent warnings, systematically failing to act on critical bad news or develop adequate functional contingency plans, choosing instead to attempt weak, ad hoc corrections that were implemented far too late to alter the trajectory of the failure. Large-scale information technology modernization fundamentally requires centralized, highly technical architectural conductors, an entity capable of maintaining holistic visibility over the entire codebase and ensuring that disparate software components interoperate flawlessly. CMS, however, attempted to act as its own lead system integrator, a highly complex technical role for which the agency completely lacked the internal engineering capability, institutional experience, and necessary technical personnel. To execute the project, the agency contracted out the development work to an astonishing 55 different federal contractors, creating a deeply fragmented, highly competitive, and largely uncoordinated ecosystem. The division of labor within this ecosystem was dangerously siloed, relying on contractors working in total isolation from one another without any overarching systemic visibility or cohesive architectural governance. CGI Federal is a contractor that was awarded a substantial $93.7 million contract in December of 2011 to develop the critical Federally Funded Exchange, or FFE, which served as the primary user-facing front end of the system. Despite possessing elite credentials, including a Capability Maturity Model Integration Level 5 maturity rating, CGI Federal struggled immensely to successfully manage and adapt the FFE to constantly shifting, often contradictory requirements provided by various CMS policy, legal, and the Office of Information Services representatives. Optum/QSSI, this contractor was awarded a $144.6 million contract in January 2012 to construct the Data Services Hub, tasked with verifying citizenship, immigration, and tax information across federal databases, and a subsequent $110 million contract in June 2012 to develop the Enterprise Identity Management, or EIDM system, which handled user credentials and single sign-on capabilities. And Verizon, or Terramark Worldwide, contracted for $55.4 million to provide the underlying platform as a service capabilities within the CMS cloud computing environment. Verizon ultimately suffered from delayed processing of hardware orders and experienced critical infrastructure outages that completely disrupted the platform on launch day. This fractured contractual structure generated what industry analysts describe as a responsibility diffusion field. A highly bureaucratic environment heavily laden with taxpayer-driven anti-corruption requirements where no single entity took definitive ownership of the system's final operational readiness. Contractors delivered their isolated software components according to the precise legal wording of their specific contracts, but CMS failed to ensure these components could actually communicate effectively in a live production environment. The communication breakdowns were profound and consequential. For example, QSSI was tasked with building the EIDM entry portal, but was entirely unaware that every single visitor to the website would be mandatorily routed through this specific system. They drastically underestimated the required server capacity because they operated under the assumption that an anonymous shopper tool would allow the vast majority of consumers to browse healthcare plans without needing to log in or register. When this bottleneck became apparent, CMS exasperated the inefficiency by directing QSSI to attempt a fix while simultaneously directing CGI Federal to construct a completely redundant new entry portal in case QSSI failed. While this may have seemed like a reasonable administrative fallback strategy, building a redundant portal expended highly critical CGI Federal coding hours that desperately needed to be allocated toward addressing massive unresolved coding defects within the primary FFE. The underlying technical architecture of the platform was heavily burdened by unorthodox engineering choices, inexperience in hyperscale design, and entirely unnecessary computational complexity. Chief among these was the legal and architectural mandate that the system had to function synchronously in real time. The architecture was designed to execute web service calls across DHS, IRS, and Social Security mainframes simultaneously, refusing to allow a user to proceed with enrollment until all external systems had responded and verified the data. This synchronous design meant that if a single legacy government mainframe experienced a minor delay or dropped a connection, the entire HealthCare.gov front-end locked up, effectively paralyzing the application for the end user. Furthermore, the project inexplicably selected an unorthodox XML-based NoSQL database system known as MarkLogic to serve as the foundational data repository. Systems architects and external critics pointed out that this was a deeply flawed choice because healthcare enrollment data is inherently highly relational in nature. For a system managing strict data hierarchies, matching individual applicants to specific dependents, tying those families to highly specific federal subsidy tiers based on IRS tax brackets, and enrolling them into distinct state-level insurance policies, compliance should have been the absolute primary technical concern. Relational database management systems such as PostgreSQL, MySQL, MariaDB, or Oracle are all explicitly engineered to enforce this kind of data integrity and are supported by vast global developer communities. By contrast, utilizing an XML NoSQL database for highly relational transactions introduces immense risk of data corruption, race conditions, and orphaned records during high concurrency traffic events. Critics argued that the database should have been utilized as a simple persistence repository to retrieve and store domain models, keeping database operations trivial and decoupled from business logic. Instead, the MarkLogic database was improperly treated as the starting point of the system, severely complicating simple operations. Industry observers speculated that this decision to utilize MarkLogic was not driven by sound technical reasoning, but rather influenced by flashy marketing, buzzwords, or uneducated enthusiasm from non-technical executives high up the management chain. Or a typical Tuesday. Arbitrary political deadlines routinely override technical realities in government software procurement, and HealthCare.gov was the ultimate manifestation of this anti-pattern. As the October 1st deadline approached, CMS introduced devastating late-stage requirement changes that fundamentally altered the user flow and system load dynamics. Most notably, in late September 2013, mere days before the platform was scheduled to go live to the entire nation, CMS delayed the implementation of the anonymous shopper tool and forced a mandate that all users must create a fully verified account through the EIDM before they were permitted to browse or compare available insurance plans. This single, seemingly minor administrative requirement change engineered an immediate fatal system bottleneck. Because every individual user, including those who merely wished to window shop for prices, was forced to register and undergo intense real-time identity verification, the QSSI-developed EIDM instantly collapsed under the crushing load of initial traffic. Crucially, this EIDM bottleneck inadvertently obscured far deeper diagnostic failures within the system. Because the EIDM effectively acted as a blocked front door, technical developers and coders couldn't easily access the live website themselves to view, diagnose, and fix massive underlying coding errors residing deeper within the system architecture. The federal front-end marketplace actually contained the larger, more systemic coding problems, but CMS and its contractors couldn't fully see the magnitude of those internal defects until the EIDM entry issues were eventually resolved. Perhaps the most egregious and professionally negligent project management failure within the entire life cycle of the initial build was the complete breakdown of quality assurance and system integration testing. The multi-year build phase was so absurdly compressed by early policy delays that the project schedule allocated a window of just 6 days for the system-wide end-to-end integration testing prior to the national launch. The specific testing methodology that was applied during this minimal window was fundamentally flawed and misaligned with the realities of modern software engineering. QSSI, acting not only as a component developer but also as the lead test contractor providing independent verification and validation services, strictly utilized formal industry standards, specifically IEEE Standard 1012-2004 and the CMMI Process Maturity Framework. This resulted in an extreme over-reliance on a practice known as requirements tracing, a bureaucratic process where functional requirements are merely checked off a list if a specific piece of code exists to address them. While the system passed these tests on paper, it was practically unusable to the end user. Because the organization rushed into coding before resolving critical design decisions, the live production-level JavaScript code deployed on launch day was filled with amateurish placeholders. The codebase literally contained lorem ipsum, filler text, and explicitly unresolved developer comments left in the live environment, such as to do, add functionality to show alter text after too many tries at login, and to do, maybe modify the below to use a similar method instead. Furthermore, the 175 pages of early war room notes generated by the project managers focused entirely on firefighting trouble tickets in the field, demonstrating absolutely zero integration with the testing teams. Testing failed to connect meaningfully to operations, support, or project management, rendering the entire QA exercise a waste of resources. The failure to execute a proper, rigorous testing phase directly and severely endangered the personal data of American citizens. An independent analysis of the site's RESTful web services, source code, and developer tabs, conducted by threat modeling expert Ben Simo, revealed systematic, highly dangerous security failures. The site transmitted usernames and email addresses across the network in plain text, loaded highly insecure external resources, and exposed sensitive user IDs through basic login notification messages. The password reset mechanisms were so poorly designed that they created data combinations that readily enabled automated phishing attacks. Most alarmingly, authenticated attackers could actively exploit the REST API responses to access highly sensitive personal data of other users, including full names, addresses, dates of birth, and social security numbers. These disastrous realities, particularly regarding the system's security posture, were not entirely unknown to the highest levels of the administration prior to launch. Teresa Fryer, the Chief Information Security Officer, CISO, at CMS, explicitly testified in a transcribed interview with House Oversight and Government Reform Committee investigators that she formally recommended denying authority to operate for HealthCare.gov. Acquiring this ATO was a stringent federal requirement to officially launch any IT system. The foundation of Fryer's urgent recommendation was that the website suffered from dangerously incomplete testing and harbored massive unknown risks, constituting a high security threat to the entire federal network. In standard IT governance, a CISO's recommendation to deny an ATO represents a definitive halt to any deployment. However, blinded by the political mandate and a culture that actively resisted acknowledging failure, senior officials systematically overruled the top security officer's warning and forced the system to launch anyway, deliberately putting the personal information of millions of users at risk. When the highly anticipated system completely collapsed upon its public launch on October 1, 2013, it quickly became apparent that standard federal contracting interventions, punitive legal measures, and traditional bureaucratic remediation strategies would prove vastly insufficient to address the crisis. The sheer volume and complexity of the technical issues, with initial triage estimates identifying an overwhelming backlog of over 600 distinct hardware and software defects, required an entirely different operational paradigm. The critical turning point in the survival of the ACA's digital infrastructure was the institutional realization that the initial project management structure had to be aggressively dismantled, bypassed, and replaced with modern engineering methodologies. Faced with an unprecedented all-hands-on-deck emergency that actively threatened the political viability of the Obama administration's signature domestic policy, Todd Park, the United States Chief Technology Officer, was tasked with assembling a highly specialized trauma team known as the Tech Surge. Recognizing the internal CMS teams and their network of massive federal contractors lack the specific expertise required to salvage a failing hyperscale distributed system, Park bypassed standard federal procurement and staffing channels. He aggressively recruited elite private sector veterans with proven empirical track records in stabilizing high-traffic mission-critical platforms. A central figure in this rescue operation was Mikey Dickerson, a highly experienced site reliability engineer recruited directly from Google. Dickerson was joined by a formidable cadre of technologists drawn from both outside and inside the government. Upon arriving to assess the state of the platform, these engineers were met with a systemic nightmare that extended far beyond poorly written code. Dickerson would later reflect that the actual technical or computer problem of HealthCare.gov was in fact the easier part to fix. The true underlying crisis that the tech surge had to dismantle was the complete lack of operational visibility, the crushing bureaucratic inertia, and the deeply entrenched organizational silos and systemic dysfunction that prevented developers from actually deploying solutions. The rescue team's immediate foundational action was to completely abandon the failed Waterfall methodology that had driven the project into the ground. They literally and figuratively threw out the multi-year bureaucratic roadmaps, Gantt charts, and phased gate approval processes, replacing them with dynamic Agile software development principles, heavily leaning into the Scrum framework. Where the initial build relied on heavily documented, slow-moving approval chains that took months to execute, the Tech Surge team introduced short, rapid, and highly focused sprints to triage and tackle the most critical system-breaking bugs incrementally. A critical, almost unbelievable early discovery by the rescue team was the absolute total lack of end-to-end application monitoring within the production environment. During the initial launch, CMS and its contractors were essentially flying blind. Without robust monitoring instrumentation, it was technologically impossible to definitively identify, prioritize, or diagnose system errors as they occurred in real time. Consequently, one of the very first technical implementations executed by the Tech Surge was the rapid integration of modern enterprise-grade application monitoring tools. This instrumentation finally granted the engineering team immediate granular visibility into specific server loads, database query bottlenecks, latency spikes, and API failure rates, allowing them to base their engineering decisions on empirical data rather than guesswork. Armed with his newfound visibility, the rescue team made the strategic decision to aggressively prioritize the stabilization of the user-facing interface, specifically targeting the disastrous EIDM registration bottleneck that was choking the entire system. By breaking the immense workload down into rapid iterative development cycles, the engineers focused solely on optimizing the database queries and authentication handshakes that were causing the entry portal to crash. By systematically stabilizing this account creation portal, the Tech Surge effectively unlocked the front door of the system. This critical achievement allowed traffic to flow into the application, which in turn allowed the engineers to finally observe, diagnose, and repair the massive coding failures that had been hidden deep within the federal front-end marketplace. The most profound organizational change instituted by the Tech Surge, and arguably the single most important factor in the project's ultimate recovery, was the forced elimination of the silo effect. To resolve the complex cascading integration errors caused by disparate contractors operating in isolation, the Tech Surge implemented a single location, highly collaborative physical workspace universally referred to as the War Room. Individual technical contributors, database administrators, and network engineers were extracted from their isolated contractor bubbles and physical corporate offices and were physically placed together in the exact same room. This war room completely disrupted the previous responsibility to fusion field. The environment instituted mandatory daily stand-up meetings, fostered continuous transparent communication regarding system failures, and most importantly allowed engineers to explore collective technical solutions directly with one another without waiting for bureaucratic sign-offs or contract modifications. To support this physical proximity, all staff and contractors working on any aspect of HealthCare.gov were mandated to utilize shared modern digital collaboration tools such as Slack to communicate more effectively and execute real-time troubleshooting. This radical centralization of technical talent and absolute accountability allowed the team to bypass the bureaucracy, enabling rapid triage and the immediate continuous deployment of critical hotfixes. By April 30th, 2014, operating under extreme pressure, the team had stabilized the site sufficiently to successfully close the first open enrollment period, though the effort extracted a high personal toll, leaving engineers like Dickerson completely exhausted and burned out. The turbulent trajectory of HealthCare.gov, transitioning from a historically massive failure to a functionally stabilized national platform, serves as the ultimate definitive comparative analysis between two fundamentally opposed software development philosophies. The traditional rigid predictive waterfall model versus the modern iteratively adaptable agile framework. This dichotomy is starkly evident across three major operational dimensions: organizational scale, systemic adaptability, and delivery cadence. The initial build operated on the fundamentally flawed, antiquated assumption that sheer organizational scale and heavy documentation equate to technical capability. CMS attempted to manage a sprawling network of 55 highly credentialed contractors, leaning heavily on the theoretical assurance provided by vendor certifications. The underlying bureaucratic belief was that the large, highly structured teams operating under strict contractual governance would naturally guarantee a successful integration. However, these dozens of disconnected contractors failed precisely because of their massive size and contractual separation. Information was inherently hoarded to protect corporate liability, cross-team communication was painstakingly mediated by formal contract language rather than actual engineering necessity, and systems integration was incorrectly viewed as a final perfunctory step rather than a continuous daily requirement. Conversely, the rescue team succeeded by leveraging a small, highly cohesive unit. The tech surge explicitly demonstrated that complex hyperscale integration problems are not solved by adding more disparate vendors or increasing the volume of project managers, but by radically shrinking the communication loop. By placing most empirically capable engineers in a single room and empowering them to ignore contractual boundaries to fix broken code, the small team operated with a unified, shared mental model of the system architecture. This allowed a fraction of the personnel to directly address and resolve integration flaws that the massive bureaucracy could not even conceptually understand. The defining fatal characteristic of the initial build was a dangerous systemic inflexibility. The project was entirely bound by arbitrary political mandates and organizational path dependency, where senior executives and project managers rigidly adhered to a flawed project plan despite overwhelming, undeniable technical realities indicating that the system would crash upon launch. A prime example of this toxic inflexibility was the late-stage requirement to force mandatory account creation through the EIDM. In a flexible, data-driven environment, a basic load test would have instantly flagged this requirement as fatal, and the development team would have possessed the autonomy to immediately revert, allowing anonymous browsing. Instead, the rigid administrative mandate was forced through without technical validation, destroying the system's availability on day one. Agile development by design and philosophy assumes that initial requirements will frequently change and that early architectural assumptions are often incorrect. The rescue team utilized Agile's core principles of empirical process control, transparency, inspection, and adaptation. They did not assume the underlying architecture was sound. Instead, they installed monitoring tools to inspect the real-time data, and they dynamically pivoted their development sprints based on live error rates and database bottlenecks rather than a static multi-year project plan. This contrast in adaptability is further highlighted by the existence of private sector alternatives. While the government insisted on a highly complex, rigidly integrated platform, a tiny private company named Opscot utilized a basic HHS rate spreadsheet to build a fully working, simplified alternative website in less than 2 person weeks. This simple version allowed users to input their zip code, age, and family factors to immediately get a quote and a phone number to complete the purchase. Opscot aggressively limited their scope to what was actually necessary, proving that deploying an adaptable 80% system is a vastly superior strategy to rigidly insisting on a technically unfeasible 100% system. In traditional waterfall projects, systems integration and quality assurance testing are universally deferred until the absolute end of the software development lifecycle. HealthCare.gov attempted a massive Big Bang integration, compressing what should have been many months of rigorous iterative testing into a completely inadequate 6-day window. This approach virtually guaranteed that hundreds of deep-seated architectural conflicts spanning between the CMS front-end, the QSSI data hub, and the legacy government mainframes would remain hidden until they collided simultaneously in the production environment on October 1st. The Agile rescue fundamentally eradicated this deployment strategy. The tech surge rapidly transitioned the project to a model closely resembling modern continuous integration and continuous delivery. Instead of waiting for massive monolithic system updates, the team broke the architecture down into manageable components, deploying small, highly targeted software fixes daily through rapid sprints. This iterative testing methodology meant that if a newly developed hotfix inadvertently caused a regression elsewhere in the system, the blast radius was highly contained and the engineering team could roll the change back immediately without bringing down the entire marketplace. The HealthCare.gov disaster is now frequently cited in advanced systems engineering literature and public administration curricula as the textbook example of catastrophic anti-patterns in IT project management. However, the subsequent stabilization effort offers equally potent, empirically validated lessons in technical remediation in modern digital delivery. These lessons were ultimately codified by the United States Digital Service into the Digital Services Playbook and the TechFAR Handbook, providing a framework to prevent similar failures. Arbitrary business deadlines or political mandates must ultimately bow to technical readiness. The insistence on meeting the October 1st launch date, despite the CISO's explicit recommendation to deny the authority to operate due to critical security flaws, caused exponentially more political and financial damage than a delayed launch would have. The lesson is clear: quality assurance, comprehensive threat modeling, and adequate end-to-end testing time can't be skipped or administratively compressed to satisfy a predetermined launch date. This aligns directly with Play 1 of the Digital Services Playbook. Understand what people need. Digital projects must continuously test prototype solutions with real people, and technical decisions must prioritize the user's need for functional systems over artificial government schedules. Large-scale software projects can't simply be outsourced to dozens of disparate vendors without a highly technical central architectural conductor actively managing the integration. The belief that a government agency could passively pass integration risk to contractors like CGI Federal and Optum/QSSI proved disastrous. When executing multi-vendor architecture, integration cannot occur at the end of the software development lifecycle. It must be executed continuously from day one. Furthermore, limiting complexity requires selecting appropriate technologies. The choice of the MarkLogic NoSQL database for highly relational data demonstrates the danger of selecting niche technologies over proven solutions. Play 8 of the Digital Services Playbook emphasizes the necessity to choose a modern technology stack. The playbook dictates that agencies should avoid vendor lock-in, utilize software frameworks commonly used by successful private sector consumer companies, ensure local development environments are easy to set up, and heavily consider open source cloud-based and commodity solutions. The initial launch was characterized by a complete lack of operational visibility, leaving developers blind to the specific causes of system failure. Play 12 of the Digital Services Playbook mandates that teams use data to drive decisions. Modern infrastructure requires teams to actively monitor system-level resource utilization and performance metrics in real time, capturing granular performance data. Creating automated alerts based on this monitoring allows engineering teams to identify issues and deploy bug fixes proactively rather than reacting to catastrophic outages after they occur. The failure to properly integrate security into the development lifecycle resulted in massive vulnerabilities, including the transmission of plain text credentials and the exposure of sensitive personal data via REST API endpoints. Play 8 of the playbook includes a rigorous privacy and security checklist, mandating that security is established early, infrastructure is pre-certified, and the automated deployment scripts are used to keep production environment configurations locked down and consistent. Security and threat modeling must be treated as critical, non-negotiable components of every Agile sprint, shifting security considerations left in the development pipeline. The initial contracts awarded to vendors trapped the government into rigid, multi-year deliverables that failed to adapt to changing requirements. To combat this, the TechFAR Handbook was developed specifically to highlight existing flexibilities within the Federal Acquisition Regulation that support iterative, customer-driven software development. Supported by Play 2 of the playbook, modern procurement must structure contracts to request frequent incremental deliverables rather than multi-month milestones, ensuring the government delivery team retains the flexibility to adjust feature prioritization as the project evolves. Additionally, Play 13 demands that projects default to open, ensuring that complete datasets are provided to the public via APIs, and custom software developed by third parties is maintained under government control to be released as open source where appropriate. The chaotic rollout of HealthCare.gov in the fall of 2013 remains a highly consequential watershed moment in the history of government technology procurement and enterprise systems engineering. What began as an incredibly costly $400 million cautionary tale defined by bureaucratic hubris, reliance on rigid waterfall methodologies, and catastrophic systems integration failure, was ultimately transformed into a blueprint for modern technological rescue. By aggressively discarding the bloated requirements and rigid roadmaps and instead deeply embracing the agile principles of iterative delivery, continuous system monitoring, and tight-knit cross-functional engineering teams, a small group of private sector technologists managed to stabilize the platform and save a monumental legislative initiative. The enduring legacy of the HealthCare.gov disaster extends far beyond the technical repair of a single federal website. It served as a catalyzing moment that permanently changed how the United States government approaches digital infrastructure. The crisis conclusively validated agile principles for large-scale IT projects, proving beyond a doubt that modern software development cannot be effectively governed by the antiquated, heavily siloed phase-gate models of the past. Ultimately, the catastrophic failure and subsequent agile rescue of HealthCare.gov proved that enterprise technology is not a static commodity that can be procured and delivered in massive multi-year blocks. It is a highly dynamic, constantly evolving capability that requires continuous architectural adaptation, a relentless focus on end-user experience, and the institutional courage to align ambiguous political and business goals with pragmatic, unyielding engineering realities. The remarkable transformation of HealthCare.gov from a monolithic, broken architecture to a highly scalable, resilient system capable of reliably processing billions of complex user requests stands as an enduring testament to the unmatched power and necessity of agile software development in the modern digital era. Well, that's all for today. If you enjoyed this video, please give it a like and consider subscribing to the channel. Until next time, thank you and take care.